and he's with a special little girl right now. Darren?
Thanks, and we are at the hospital now. We're here with Dr. Gerton, and we're here to meet Olivia. And Dr. Gerton, tell us about Olivia and what brought Olivia to Sparrow.
Olivia has a disease called Alexander's disease. It's Leukodystrophy, which means that there's degeneration within the central portions of her brain. And the result of that is that she has trouble now with muscle tone. She has trouble handling secretions. She's prone to pneumonia. It's difficult for her to cough. And when you have a child with special circumstances like this, the most important thing probably is that you have a family that is so in touch with her that they can figure out when she is in trouble. People who do not have special needs children are not in that position. They don't know the children well enough.
Right.
And you have to be able to interpret what you're seeing in front of you from years of having had to do that. And I know that that's what you guys had to do just 4 days ago. Can you tell us about it?
Yeah, well, just with Olivia's disease and everything, we just never know what's going to happen, really. And any type of a cold or flu or anything that goes around usually brings quite a bit of paranoia, because if she gets even the slightest cold, she has a hard time getting rid of secretions. And we have a suction machine at home. We have a chest vibrator machine. We work with her a lot, but sometimes we cannot do what needs to be done. And
What brought you to the emergency room?
she was having a hard time clearing. She wasn't breathing right, and she was clearly struggling really bad. And so we were actually on our way to another appointment and had to decide to bring her into the ER to make sure that she would be okay. And so when we got here, she kept getting worse and worse, and then obviously
To the ICU?
yeah, and then we brought her in the ER.
When what we discovered was actually she had a couple of things wrong. She had a high fever.
Okay.
She was in what we call septic shock, so her body was shutting down. She did have pneumonia.
Okay.
And so she had this combination of events. She responded well to antibiotics, to vigorous attempts to get her to cough. And once she could start clearing, we were able to keep from having to put her on a ventilator. We did have to put other lines in her and things to be able to manage her, but she just spun around. It was
3 days, right?
Yeah, this is day 4.
Okay.
And the Leukodystrophy are going home.
What does it mean to you to have a resource like this close to home?
It means the world to us. It is very nice to know. We've been to clinics and hospitals that are much bigger in much bigger cities, and to have a resource like this in a smaller place like Lansing, right close by. The care we've received here, I would put it up against any care we've ever had, if not better in a lot of ways. The nurses are great, the doctors are great. It's just unbelievable to think we have this kind of resource in Lansing.
And it has been a 25-year effort.
It sure has been.
In 25 years of working with the Children's Miracle Network, we've brought together not just the facility, the PICU, the doctors, and the nursing staff. There are nurses who work in that PICU who have worked with Olivia before. There are nurses in that PICU who have been here for 30 years.
Wow.
And that kind of longevity and our familiarity with patients like Olivia helps us. We know her.
Right.
It isn't just about her disease. It's about knowing her. And you've come here before. You've told the story before. What motivates you to do that?
Just, again, the care that we get. It's just unreal. And again, you hit the nail on the head. We come in and we know the nurses, we know the nurses' families, they know us. It's, aside from all the medical care, it's just so reassuring to us, because it's comforting for Lisa, it's comforting for me. We don't have to worry about the way they take care of our child. It's almost like they take care of her as if she was their child, you know?
I have to tell you, it's 25 years of miracles, and they just keep coming.
They most certainly do. We'd like to thank you for telling us your story and Olivia's story. We want to ask you if you could pick up the phone and give a call to the number on the bottom of the screen and make a donation. We always appreciate it. We send it now back over to the professional building.